Good evening to all the viewers who are watching live and will be watching on the recorded version. Sorry, I entered from a different phone and this was the main issue. And once again, this CME will not contain any e-poster thing, e-certificate thing. So we are very sorry for that. And again, once of all, we are already being late. And so without wasting any more time, let's just jump into our 30 seconds countdown time. Yes, 30 seconds countdown time.
Good evening, everybody. And we are on the 108th online live CME tonight. We like to congratulate all the team who are working wholeheartedly at the background to cover the sessions on a regular basis, updating every which is required to go ahead with the live session. Tonight we have a very important topic, evaluation of mental state. And to go ahead with this, I'm proud to announce on the fact that we will be having this in three parts. So, bang on, come 2025, wishing everyone a happy new year, and we wish all the doctors, all the alumni, and the homeopaths of the fraternity who are watching and will be watching this CME in the later stage will be benefited from our station. And what else the topic can be? Examination of the mental state. To inaugurate the 108th CME tonight, I request our beloved Dr. Geetha ma'am to please inaugurate and start the session. And before that, I'll like to apologize for the fact that we had our moderator tonight, Dr. Radha ma'am, who had been facing a family challenge, mishap in her family, but she is attending to her family emergencies. She will be there in the next part. So to continue with the moderation part, we are not seeing tonight with me on screen our beloved President, Dr. Who will be the moderator tonight. Thank you. And I request our backstage editor, Dr. Mukherjee, to bring on Geetha ma'am to inaugurate tonight's session. Good evening and Happy New Year, ma'am.
Good evening, our respected dignitaries on the dais and our esteemed participants of today's webinar. It gives me immense joy and pride to stand before you as an inaugurator of this section, organized by our association, National Institute of Homoeopathy Alumni Association. I am Dr. Geetha Pillai from Kerala, for 5th N.I.H batch. I was a professor and HOD of the Department of Pathology and Microbiology in Government Homeopathic Medical College at Thiruvananthapuram and Kozhikode. Now I am retired and engaged in private practice. As we all know, our association is constantly contributing to enrich our knowledge, like this through the CMEs. And today's today it is 106th CME, and the topic is examination of mental state. The topic is both relevant and very thought-provoking in our daily practice. Now, first of all, I would like to take a moment to extend my warm regards to our dedicated General Secretary, Dr. Bidyut Mukherjee, and the pillar of strength of our association. Let us join me to extend a warm welcome to Dr. Sir, I am extending a warm welcome to this session on behalf of all the participants here. Next. Then I am extending my affections and warm regards to our young and enthusiastic IT manager, Dr. Mukherjee. Then let me say a few words regarding our moderator. First of all, I am sorry to hear that our moderator, Dr. Radha Madam, is not able to attend this meeting today due to some family tragedy. And our president, Dr. Kalyani sir, is stepping in to take this role. So, I would like to extend a warm welcome to our today's moderator, Dr. Kalyani sir, the dynamic leadership behind the CMEs and association. Let us join me to extend a warm welcome to our President, Dr. Narayan Kalyani sir, to this meeting. Sir, I am confident that your presence will enrich this section. And sir, we are sure that you can steer this session with clarity and precision. Then about our speaker. It is my personal pride to introduce our speaker. He is my classmate, 4th N.I.H batch. Dr. Kalyani sir is my immediate senior, 4th N.I.H batch, and I am from 5th. And Dr. Bankim Prasad Mandal is a proud alumnus of Calcutta Homoeopathic Medical College and Hospital. And he started his career as lecturer in Materia Medica in different homeopathic medical colleges at Calcutta and other parts. And with his profound knowledge and teaching skill, he inspired a large number of students. And he was examiner for different examinations. And later he joined in Kerala Government Homeopathic Department as medical officer. And now retired and settled at Kannur, the northern part of Kerala, and engaged in private practice. We know today's topic, the examination of mental state, is the cornerstone of it is a cornerstone. Examination of mental state. Then, and with profound knowledge and deep understanding and an extensive understanding, Dr. Bankim Prasad Mandal is the perfect person to talk on this subject. And we are expecting and inspiring, highly informative and interesting talk from you, sir. Then, lastly, before concluding, let me express my sincere thanks to the office for giving me this opportunity to inaugurate this function. And then let me extend my sincere thanks to all the participants here for their time, their valuable time and attention. Now I request Dr. Kalyani sir to take the stage and continue the session. Sir, over to you, sir.
Thank you, Dr. Geetha Pillai. Many thanks for coming and joining with us. We are highly inspired by your presence. And now today's seminar will be a brilliant seminar, I can tell you, because the speaker was my classmate. I know him very well, as vice versa, he also knows me very well. Our foundation was on mental symptoms in Calcutta Homeopathy Medical College. Our teacher used to concentrate on mental and physical journals, mostly. Very rarely particular symptoms, unless badly required. So we have seen our teachers were not that much brilliant speakers, but what they have shown to us in OPD and IPD are gems. We cannot forget it. And our teacher used to tell us that see and build your confidence. Only 4 years in Calcutta Homeopathy College, our teacher used to say, we'll give you 40 years of experience if you see how homeopathy is curing by minimum doses, how brilliant, sincere, serious cases are getting cured. So Bankim Prasad Mandal, along with his personal experience, he will contribute regarding mental symptoms, which is very, very, very important for homeopathic practice. Thank you, Bankim. Please start your presentation. Dr. Bankim Prasad Mandal, please.
Thank you, Dr. Kalyani. So, because we were in the Calcutta Homeopathic Medical College for 4.5 years. That is actually, it is a 5.5 years because of our this sessional problem. So those days was the first there's a preliminary education system of homeopathy for us. I think just now what you have just mentioned, that our teachers what we got the teachers as Dr. S.K. Dubey, Dr. P.C. Pal, Dr. M.M. Datta, their idea, they have injected this idea of homeopathy to us, I should tell. Now the thing is this, those days was a really this thing is this real teaching days. We are students those days, and as you told just now, that these are we have experienced a lot in that Calcutta Homeopathic Medical College. There I can just I can make I will tell afterwards a few things when I will go into the subjects. What are the things? Then I can cite some examples that what really we got from them. So about my this thing, my introduction about me, that Dr. Geetha told already. Along with these things, this thing I should tell that we are now we are maintaining on another online coaching for AIA PGET. With my two daughters, my wife is also there, the Dr. S. Geetha. We are for last few years we are teaching. We are giving coaching for AIA PGET for admission for the MD courses all over the India. Now, so this thing is this, why I have taken this subject. That means we know everything. We have already learned all these things. Whatever we will tell, I will tell today or in next two sessions. We have learned. We have our teachers taught us, but I failed. I failed afterwards. Afterwards, that may not be the complete. So for that reason, in the objective or because of in my mind, it is the objectives. That means to understand mental symptoms. So we have our teachers taught us these are the mental symptoms. These are the mental symptoms. These are the mental symptoms. But I feel we could not understand in the UG classes. We did not understand the actual mental symptoms. What is to be taken for homeopathic prescription for the totality of symptom for the and to find out a better rubrics and to individualize the patient with the and ultimately to individualize the patient with a for the perfect simillimum. Now, for that reason, I think after this session of the examination of mental state, a total, not the first session, all the three sessions, we will be able to understand. We will be able to understand the usefulness of examination of the mental symptoms. So once again, welcome to all all viewers for the examination of mental state. These things in generally mental state. And what is the use of this mental state? We have to find out where they examine the mind. So if it is there, what is mind then? What is mind? Somebody, if we get some bad news, we sometimes, or we are in a real problem, we put our hand on head. So it seems that mind is in our head. Or sometimes when we feel very sorrow for somebody, then we put our hand on our mind, on chest. So as if the mind is in the chest. But actually, what is mind? Mind is a conscious and unconscious. Mind is unconscious. There is conscious and unconscious state. State is a unit. Conscious state and unconscious state, which thinks, perceives, feels, wills. And so this is the mind is a subject of consciousness actually, which thinks, perceives, and our mind maintains the intelligence. So in these things, our mind actually, what actually mind? Mind is a consciousness and is a unit. Mind is a unit, which consciousness and unconsciousness makes an unit. And then in normal person, mind maintains the intelligence or the intellectual potentiality. If it is so, the mind, or in other words, if we tell the psyche, the psyche makes an unit of id, ego, and superego. Id, ego, and superego. So in that one, again, the same thing what I felt. The mind, what we get in the definition, that is human soul, mind, spirit, or invisible animating entity. What we feel about the vital force, we talk about the vital force. So in Freud's theory, Sigmund Freud's theory, the mind is having three parts: id, ego, and superego. The id, what is id? It is an instinct. It is an instinct, the part of the mind in which innate instinctive impulses. So it is id. Then what is ego? Then what comes in the ego? Ego is a reality. What is the id never bothers about the reality. Id is the instinct, and ego is a reality. Then what is the superego? Superego is the moral factors. That means morality, or the self-critical condition. Self-critical condition, which moderates the ego, which moderates the ego and id. That is superego. If it is so, then id is instinct. Id means instinct, and the ego is reality, and superego is morality. In other words, we can differentiate. About the id, ego, and superego. That means id is the impulsive part of our personality, or the consciousness, or ego is a conscious part of our personality that mediates between id and superego. At the same time, superego. What is superego then? Superego is just few minutes more. Just I told you, the superego is a morality. That means in the self-critical conditions, conscience, social standard. The superego maintains ego and superego on the basis of the social standards, which we learn from our parents or teachers. So superego, id, ego, and superego. So then So these are the definition of our mind and its parts. So in organ of medicine, starting from aphorism number 83 to 104, Dr. Hahnemann, our master instructed instructed the physicians to investigate and tracing the picture of the disease. That is, to picturize a patient. So for that reason, at first, today, at least today's session, I will give a simple outline for taking a case. So generally, till in our UG classes, we learn in this way that patient you go and take the case, ask the patient and take the patient history and all these things. And we used to, in classes, we used to go to the bedside and we used to ask the patients, what happened to you, this, like this. But thing is this, in classically, if we approach to a patient, the patient, we will tell, the physician must tell the patient to tell his history, his story, his own story. And what will be patient's attitude? Attitude should be, patient must be receptive. He must behave like a receptor. He must be clear of his mind of the other occupations and previous opinions of the patient. The patient may be his own parents. Patient may be his own friends, his relatives. In that respect, in that context, the physician may have some previous idea about the patient. But those things should not work when we are taking a case. The physician must be tranquil, cordial, silent when the patient tells his story. So physician must allow the patient to tell his story in his own way. Do not disturb. The physician must observe from the moment the patient enters the main points to be noted. The personality of the patient, the apparent state of his mind to the in respect to the doctors or his attendance of about his race, physical status, all these things. We must try to understand traits of characters. So here I can tell one thing, that when I came in Kerala, I was not knowing this language. I was not knowing the language. Only few words, only the communication words, sentences I knew. But still, I prescribed the medicines. Still, and till today, till those days also, though who were my patients, still they used to come to me for medicines. Only thing is I have followed this part, that the patient's personality, either through his body, his status, gait, complexion, or his cleanliness, uncleanliness, all these things, his mental status of overconfidence, haughty, or fearfulness, anything like that. So during this thing, physician must record. During this time, he will be very silent, but he must be going on recording what the patient tells to him, his attendant tells to him, or what he observed in the patient. Common. Okay, so these are the things what I feel. I felt it and I have done it, and now with this thing, I must tell I am benefited with these things, because it helped me a lot in the prescription, to making a prescription. So our topic actually mental symptoms. So before that, there are mental symptoms. There will be so many symptoms which is correlated with mental symptoms. So our topic is mental generals. So when the patient, in this respect, when the patient is going on telling his story, when the patient comes to a standstill, just ask them, what else? The objective, the idea to drain out the patient about him, what he knows about himself. Okay. So the patient, but at the same time, the patient, if the patient is loquacious, we must guide it. We must guide the patient to remain in this main track and to prevent the talking about the irrelevant things. After all these things, we must ask few questions. Few questions for special knowledge we can ask. At the same time, we must ask some questions. We must guide some patient, something to the patient to gain the patient's cooperation. Generally, most of us we overlook this thing, that the they say you have you are having this problem, that problem. Okay, you take this medicine, you will be okay. You will be just what gives you relief. What is for anything you are getting when this problem is getting increased or when it is reduced. The modalities, and you prescribe a medicine. But thing is this: in this thing, we must get a cooperation from the patient, and it helps in the intimate questioning. So in this respect, sometimes I used to tell what I do. I used to tell for something when I felt or I felt that yes, almost we can guess some medicine, some 3 or 4 medicines we came in my mind. Then I sometimes still I ask them, can you tell something exactly what happened just before this problem, your disease? What actually happened those days? Any incident, any accidents, any fever, any these unlawful medicines, any medicines, whatever it is, whatever you have taken. Is there any information? Anything untoward happened to in your family or with you, whatever it is. So this type of things. So question must be asked according to a standard and a status, according to the disease itself. Or sometimes I used to tell if this type of question is not required, still I used to ask, okay, this I will give you medicine now, but only is this after 2 days you must give me or next week you must report that in 1 day how much urine you are passing. So for that reason, every day morning to evening, you must collect the urine and see that it is more or less, it is reducing or increasing. Or you can assume that sometimes it is 1 liter, 1.5 liter, or something like that. You must tell after next time. So with this thing, patient will feel that doctor is having an interest in my case. Okay. Now, thing is this: some instructions. So what I told you, some instruction must be given to the patient, so that patient feels that the physician is going to thoroughly and scientifically with this case. So such as examination of urine, blood, and according to this thing, at last, according to these things, according to his disease, his condition, we may advise for the examination of urine, blood, or the sputum, whatever it is, or X-ray, whatever it is needed. Now, all questions, this thing already we know, all questions will be put to the patient in such a way that they cannot answer in a single answer, yes or no. That we know. We have learned so many times, so our teachers taught us so many times. But at the same time, if the patient thinks, the physician has seen that a fairly definite remedy picture is in patient's story, still he must be very careful. And he must be very careful that is not to lead the patient into the answer he desires, or even ask the opposite or suggest the opposite and see the reaction and watch the reaction. And with this thing, we can verify the symptom. So verification of the symptom is a must, is a very important. Physician must be sure that he has questioned everything to the patient. So it's still what physician is to do to the patient, towards his patient's attitude towards the patient. Then mental symptoms, still I did not tell all the mental symptoms. Mental symptoms and characteristics patient usually be elicited at last. It should be about mental symptoms we must ask at last, when the patient's confidence is fully gained. Then only we can ask. Thing is this, evaluation of the symptoms, emotional causes of the diseases, or ailments for notification, suppression of sex or angers or whatever it is. So many questions may come. So that will be asked at last. So why some suppressions of ailments, suppression of so many ailments, so many problems, so many diseases due to suppression of so many so many reasons, so many causes, might rank a most leading and most important symptoms in their cases. Then comes that still patient's attitude is still at the close of the interview, the patient must feel that what I have just few minutes back I told that the patient is the physician is mostly or deeply interested in his case, or that the physician will study the case afterwards. Even I leave, a physician will study this case. So for that reason, physician asked me to ask me this results, these examinations of urine, blood, and all these things. At the same time, especially in the whole day, how much urine I am passing. So these are the things. One, then this method is a very good method. He must feel that this method of this questioning or inquiring is a very good thing. He must feel. Otherwise, he won't tell anything. And his constitutional defects or anything, whatever if he has, that will be corrected. Then comes the physical examination before and the routine laboratory test that already I mentioned. Of any special test as per history must be done. For every new patient, it is easy, it is very special, or it is necessary to do few symptoms, few examinations. And all patients either yearly or when it is needed. Or patient must be guided that he should not take any other drug during this treatment, or if he has to take it, he must inform the physician. Or at the same time, he must be informed about the danger of the suppurations and whatever it is, the medicines he is taking, he must report back. Or at last, after taking this medicine, physician must confirmed that he must tell to the patient that after taking this medicine, the effect of first result or first benefit, what he is going to get. Now, one thing is this: during this time, I feel I could tell you that this establishing a rapport with the patient is of great importance. Otherwise, which helps to ask personal questions, and most of the time it helps a lot. But at the same time, there is a caution that so many patients don't like that. That means the nervous patient don't like that they have been talked over. So before this asking some his questions, before asking these things, question, we must be very careful. This may be sometimes dangerous. Or sometimes what we do, sometimes what we used to do, that, we can ask the attendant, about his behavior, this thing, that thing. So that may be sometimes very dangerous, as nervous patients hate to know that they are being talked over. But the physician must be very careful and wisely control the case. So next comes, really, after these things, we till this time you can see these things. We did not ask so many questions to the patient. Only what he described his story, just we have tried to confirm it. We have tried to confirm it. Now, so then comes complaints and physical particulars. Now, one by one, whatever complaint he has described in his story, we must qualify this thing, symptoms. What does it mean? What I am trying to tell? That means we know every symptom must have some qualifications. Location, sensation, modalities, concomitants, and all these things, whatever we learned, they are the qualifications, qualifying points. So in that respect, every questions, every complaint, whatever he asked, when physician noted in his book, must be qualified. So for that reason, next few minutes I will talk about these things. But thing is this: still be careful. Don't ask mental generals at first. But we will try to categorize the mental generals, physical generals, and mental generals, particular and modalities and concomitants, one after another. So that same thing, according to this thing, our knowledge, that is location, sensation, modalities, and concomitant. So still, only this modalities, concomitant, location, sensation, modalities, and concomitant is not the all. It may be caused, starting from causation, prodrome, onset, pace, at the intermittency or intervals, frequency, repetition, or sequence, duration, special, or if any any special characters, location, laterality, extension, and radiation of pain or sensation, then concomitant and alterations, aggravation and amelioration. So in this respect, causation, there are so many medicines having strange symptoms with a causation. Prodrome, exactly what happened just before this thing, before his complaint. Onset, how it started. Pace, intermittency, repetition, sequence, duration, special character. Special character means, what is the special character of this thing? In just one example, fever with lower part cold, high fever with leg cold, So nothing to, no need of any other symptom. It is a very special, strange character. So it is a, like this, we must go forward. Then actually, the all other things, all because of why I have kept this thing, aggravation and amelioration at last, because all other things, all other points are special, and the aggravation and amelioration, these are the particular points indicating towards a particular problem. Next comes aggravation, amelioration. This what I have written here. This it is related to both aggravation and amelioration. The time, that means which time it aggravates or ameliorates. It is more or less. So time. So different time. So in this thing, I need not to explain one after another. But we know everybody. We all are doctors. Now, next comes temperature and weather. So we know chilliness or warm-bloodedness or chilliness, warm-bloodedness, or heat, or cold, or storm, or thunderstorm, or open air, closed room, all this uncovering, covering, stove, heat of stove, or stuffiness, or crowded place. All these things are having a rubric in our repertory. So all these things must be asked according to the condition, complaint. Then bathing. Then it may be bathing, it may be rest, but hot or cold water, local applications, hot or cold, or rest, full body rest or part of the body rest, motion, whole body motion or part of the body motion. All these things, one by one, we must ask, we must inquire for qualifying the symptoms. All these questions should be asked according to the symptoms, or some about the motion. We can tell car sickness, which is car sickness or betterness, or high altitude sickness or betterness, air sickness, air travel sickness or betterness, or sea sickness, sickness or better. So all one after another point, or any external stimuli, suppose touch, pressure, rubbing, constriction, or massaging, or stepping, or all these points, or hearing a music, or conversation, orders, or smell, all these things may be very much important. You see, one in this respect, I can give a example. Give an example. That the thing is this: few years back, one lady was having a CA head of the pancreas, and he was sent to home and to die, and sent back and to die at home without any without they have given so many medicines without any effect, and they have tried to try cannula putting, try to put on cannula in the ampulla, in the ampulla, but there it did not work. Then they were very rich billionaires here, So one day, and their some relatives, their relatives were my patient. So one day they told, there's my grandmother is sick like this. So can you see? Is there any medicine for her to? Yes, we know she is having a cancer. She will not be there for a long time. But till that time, can you give a medicine for relief? Then we went there. We have seen everything. The patient was unconscious, and we have checked the pressure, whatever the other thing, this thing. Then immediately, then after that, after this thing, then myself and my wife, Dr. Geetha, S. Geetha. We both were there. And those days my younger daughter was a child. So so we were there. After all these examination, and all this information, they have seen, they have shown us a very big case, big answer, very big doctor's name, and this Dr. Geetha must be knowing that lecture hospital, in the lecture hospital, or in the this cancer specialist. He is the final person there. Final person there. If he tells no, that means no. Like this. So we went there, and after this thing, we have looked. I looked each other, but we did not get any answer, any symptom. But they told, okay, before going, before leaving, just have a tea. Then immediately, then they have opened the door. They had opened the door because on the way, the door of this kitchen and this dining hall. Then immediately, that lady, eldest son and daughter told the maid, servant, don't open this thing, don't open this door. Let them take inside with the other door. Then why? Why happen? Why this thing? Even in this unconsciousness, if this door is opened and he gets some smell of this food, he this lady, she starts making sound that as if she is having trouble. So as soon as we heard this sentence, heard it, myself and my wife, Dr. Geetha, we looked each other, and we have finalized the symptom. We have finalized the symptom, and we have given the medicine. They have accompanied us. They have accompanied us to home, and then we have given colchicum to this patient. Colchicum, and then colchicum in 15 milli bottle in water, 1 drop, and we sent them. Then we told them to give it one small cap. That means 1 milli, 1 or 2 milli cap every till you sleep. Give one dose every half an hour till you sleep. In the morning, when the man got up, and he was very much afraid that his mother is not in the bed. His mother is not in the bed. Then what happened? And he saw that the front door is open, and he saw that his mother is walking in the yard, walking there. So they were very much satisfied, and when the other doctors, these cancer specialist doctors told he may this lady may maximum she may survive few weeks. She was there. She was next 4.5 years. She was there, and then she expired by some other. Hypertension. Because of the hypertension, she got some problem and she expired. So these are the things. A simple one symptom we should not miss. There is only only intention to tell these things. The external stimuli. That then comes. So like this, whatever it is, these orders. Last in external stimuli. This last in I wrote it orders. So this type of order is sometimes very helpful. Then positions. Which position? Standing, knee crossed, rising from sitting, or stooping, or lying down, or sitting, putting the crossed legs, or like this. All this thing according to this, all these symptoms, that means according to the condition, according to complaint. Then his eating habits, his thirst habits, eating habits, that means there itself it comes in general, that means in before, during, after, or cold food swallowing, or the craving for vegetables, or craving for food materials, or these food materials. Then comes thirst. The quantity, frequency, hot, cold, whatever it is. Then bitter, ice cold, lemonade. No, all these points must be cleared up. All these things, first about these things, or it must be qualified. We must qualify the symptoms. Then comes sleep. So same thing in general, before, during, falling asleep, in first sleep, after sleep. It sometimes, so many times, these sleep points helps in small children with nocturnal enuresis. This it helps. Just during sleep or on falling asleep, the first sleep, all these things, the child passes urine in the bed. So this point very much helps in our prescription. Then comes menses. Menses before, during, after, or suppression of this thing, acid complaint if there are any, or sweat, hot, cold, foot sweat, sweat on the forehead, or head sweat. So head sweat, back of the head sweats more. We think about the calcarea group. Or then comes any other discharges. Then comes sweat, menses, and at last, and again it comes the other discharges, bleeding. It may be from nose, epistaxis, or it may be coryza, it may be diarrhea, it may be vomitus, it may be urine emissions, or leukorrhea, or it's the same thing. All these things may be suppression, or the lochia, it may be suppression of lochia. Then comes any aggravation, amelioration with his complaint with coercion, continence, abstinence, masturbation, desire and act, any association with his main complaint. Then comes emotions. Any changes, anger, anxiety, grief, mortification, fear, shock, consolation, apprehension of crowds, anticipation, suppression, or suppression. At the same time, along with these things, all the time, the patient must be very careful, very vigilant, that not to miss a single strange symptom which is strange, rare, singular, black letter, uncommon, peculiar, and characteristic symptoms. If there is any, a patient should not miss. So for that, he must be very vigilant. At last, this is the second part of this thing, that patient as a whole. This patient as a whole, that means till this time we are talking about physical troubles, physical complaints, which and we are trying to qualify the symptoms. Then comes mental. Now it comes mental generals and physical generals. Still, these mental generals, although I have written there in mental generals at first, but to be studied at last, or on convenience. We have to see is there any mental symptoms, mental generals there or not. And then physical generals. What do you mean by these physical generals? Till this time we have talked to so many things, so many physical generals. But now again, there is a constitutional type of the patient. Endocrinological problem or homeopathic constitution. Is there any genetic problem, genetic constitution, or hereditary problem? Or what we talked about, what we know about what we believe about the homeopathy as miasmatic constitution. At the same time, in physical general, we must try to realize, we must try to understand the physician. A physician must try to understand the lack or excess of vital heat, lack or excess of reaction, lack or excess of the sensitiveness, etc. So many things. So at the same time, if we must feel, we must try to understand the ailments from motion is also a general symptom. Also, and at the same time, it can be the same sentence can be used for the mental generals also. But now we are talking about the physical general. So there may be physical problem. That means menses, menses, sweat, leukorrhea, catarrh, diarrhea, eruptions, suppression of all these things becomes a physical general symptom. It becomes a physical general symptoms. Okay. At the same time, now these diseases and diseases like malaria, rheumatic fever, skin diseases, suppose scabies, eczema, or ringworm, eczema. Sometimes we feel, oh, ringworm is a simple thing. This is not having a general effect, but that may be. Sometimes it may prove wrong. Eczema, psoriasis, lupus, etc. Syphilis, gonorrhea, nephritis, TB, hemorrhagic diseases, hypertension, or cancer, congenital diseases, genetically acquired diseases, all these things as a gives sometimes give a physical generalities. And pathology such as hemorrhoids, fistula, motor tumors, exposure to cold or catches cold easily, wet, sun, catches cold easily after after getting wet, or getting headache after sun heat. Is it so, or getting so many problems after this sun heat? So this may be at the same time from mechanical conditions such as overheating, overwork, injury, etc. At the same time, the blueness of the gum of the lead workers, whoever works with the lead. All these things are physical things, but it is a pathology. Why I am telling these things? Sometimes we so many times, or sometimes or most of the time, we overlook this thing, and we don't take this pathology as a general symptom. But we should not forget. I will tell you this thing, that Dr. Stern, who is a very good practitioner, very good prescriber, he used to take only three symptoms. He used to prescribe on the three symptoms. Number one, mental general. Number two, physical general. And number three, pathological general. With this thing, only with this point, he used to prescribe in homeopathy, and he was really one of the authority of these prescriptions. Then at last, again, we must tell the menses. Whenever we go for menses, it must be having some 4 or 5 points, or even more. That means number one. So the date of establishment is menarche. When is menarche started? Whether it is regular, duration, color, consistency, order, amount, clots, membranes, pain, modalities, concomitants, aggravation or amelioration before, during, or after both physical and so aggravation or aggravation and amelioration after physical or mentally. When the patient is having any physical or mental problems, then this menstrual problem is more or less, or if there is any symptoms of menopause or other discharges. So every this thing. So what I am telling all this one after another problem must be qualified. So to qualify a menses or a discharges, we must realize, we must see these causes, color, consistency, order, acridity, blandness, or symptoms of suppression if there symptoms of alternate with anything hot or cold, partial mm, hot or cold, or any partial discharges, or sweat, lateral sweat. Is the lateral, if it is a lateral one-sided sweat, one-sided sweat, or sweat of the on which person lies down. So like this, there are symptoms, there are uncommon symptoms on which we can prescribe the medicine. Then comes sleep. Again, sleep comes better from worse, better or worse from position, aggravation, amelioration, aggravation, difficulty in getting sleep, or somnambulism, talking in sleep, restless during sleep, or frequently waking during sleep. So many, these points must be clarified. Then comes restlessness. So restlessness, that means this restlessness, frustration, weakness, trembling, chilliness, fever, etc. All these things. Then everything comes along with this aggravation, amelioration. Particular with all one point. What are the things? What are the aggravation and this thing? We have to see the patient amelioration applying to whole body, whole patient as a whole. Then pathology, which applies to the patient as a whole. The pathology which applies to patient as a whole, such as tendency to tumor, whence just now a few minutes back I told you this tumor, hemorrhoids, this tendency to suppurate, all the tumors, whence cysts, polyps, warts, moles, or tendency to suppuration, tendency to sweat too much. So all these things comes under the pathology. So like this. So then comes our mental generals. So in our UG classes, our teachers, they did not, most of the time they did not influence us, or could not tell, maybe because of the timing and all these things in the class schedule and our syllabus. This must so mental symptoms was not that much elaborated to us. We are taught in this way. Will means love, hate, and all these things comes under will. Understanding, delusion, illusion, confusion, etc. These are comes under understanding. Intelligence problem. That many mistakes of anything, it comes intelligence. And the morals and mischievous people, good or bad thoughts, sympathy, empathy, all this comes under morality. And this memory, old, recent weakness or loss of memory. But if we go in detail, then what is will? What is will? The will is the power of making a reasonable choice of decision, or controlling one's own action. So it is a power of using one's own will. Stresses affects the power of will, choice of decision. So inclination to do something, inclination to or longing to do something, craving, so hankering to do something, to anticipate, to resolution, emotion, suicidal tendency, loathing of life, lasciviousness, revulsion, disgust of sex, revulsion of sex, sexual perversions, love, hate, fears, ghost, fear of ghosts. So we know fear of ghosts, fear of animals, fear of insect, fire, greed, eating, this fear. Under fear, even greed comes. Eating, greed of eating, greedy of eating, or that means that comes under desire. Money, emotionality. So then comes the suicidal tendency, at the same time homicidal tendency. Homicidal tendency, desire or aversion to company, family, friends, etc. Jealousy, envy, suspicious, obstinacy. Then at the same time, the oppositionness, contrariness, stubborn, disobedient, depression, loquacity, weeping, laughing, impatience, consciousness, all comes under will. Then comes understanding, the mental quality. The mental quality, act or state of persons, act or state of a person who understands, comprehension, ability to work with understanding, knowledge, power of comprehension, all comes under the understanding, discernment, that ability to judge, and awareness, empathicity, judgment, thought, belief, sympathetic, apathetic, whatever it is, the deliriums, delusions, illusions, hallucinations, mental confusions, loss of time sense, loss of place sense, superiority complexes, inferiority complexes, all comes under understanding. That means the there is a clash of ego and superego. Then comes intellect, concentration, makes mistakes in writing, speaking, studies, comprehension, confusion, etc. Then the ability to reason or understand or to perceive relationship, differences, etc. That comes under intellect. Power of thought is intelligence. Mental ability, intelligence. Acumen, ability to judge and taking a decision, intelligence. The power of reasoning, intelligence. Power of logical explanation, intelligence. Keenness, intelligence. Insight, intelligence. Sharpness of mind. What we tell, yes, he is very sharp. That sharpness of mind is intelligence. Cleverness, intelligence. Quickness in understanding and dealing with a situation, intelligence. So all these things comes under the intelligence. So intelligence. When I take the a particular mental state examination, all these things will come and we will discuss elaborately. And then comes moral or morality. Sometimes we call moral aspects, we can use this morality. So moral quality of character towards the self, society, family. So right, which is right or what is wrong. So that also influenced by the intelligence. The character of being in accord with the principles of standard or right conduct. So many things. It may be virtue of sexual conduct. It may be anything which is having a particular ethics. It may be honesty, purity, decency, ethical, trustworthy, consciousness, or saintly, or ethics as per principle, honesty as per truth, purity without any fault, decency, social improvement, decency, trustworthy, truly can be depend on, trustworthy, whom we can depend, conscientiousness, that we as per value of fact, or saintly, by virtue of sexual act. So all these things come under moral or morality. Again, moral quality of our character. Moral quality or character depends on the how we can improve it, by our teaching comes from our teachers or parents or the friends. The character of being in accord with principles, standard, in the right conduct, virtue to behavior. The behavior showing high moral standard is called in that one we call it virtue or chastity. A principle right and wrong in conduct, adherence to approved standard of sexual conduct and all these things. So there again we can realize, we can tell that it is a part. It is a part that in the ego and superego. This is the conflict of ego and superego. Then comes purity. Then comes purity. The purity conforms to the generally accepted standard of goodness or rightness. It may be in some character, conduct or character, or sometimes especially in the sexual act, or ethical, which implies to the elaborated code of moral principles. Then rightness implies to the moral blameless or justifiable, holy or noble, reliable, consciousness, then pure, chaste, innocent, virtuous. That same thing, virtue implies to the excellent character. Memory. Then comes memory. What memory we tell? Memory is we call the memory the power of recalling or power of reproduction of all experience. Power of reproduction of all experience. The recollection of facts of mind. It is said in that we tell in the sentence like this: the power of recalling or recollection of facts to mind previously learned, past experiences. So it is a recollection of all ideas, it is a recollection of old experience. So this may be consciousness memory. It may be subconscious memory, the unconscious memory, retentive memory, ready memory, visual memory, auditory memory. So these are the different type of memory. Now, memory can be what we generally tell about photographic memory, short memory, weak memory, or remembering of old events, remembering of recent events, and forgets other things. At the same time, forgetfulness. These also comes in the memory. That is weak memory, forgetfulness. Or at the same time, there is a false memory, confabulation of confabulation. This also comes under the memory. Then comes our, with these things, generally what we have learned in our UG classes, UG classes, that from starting from the asking his name, age, writing his aim, age, address, all these things, and his history, and inquiring about so many other points to qualify of the symptoms, his physical symptoms, his blood test, this thing, blood test, blood report, all other X-ray, whatever it is, lab test. At last, we must feel, and the physician, these are the I will tell, the physician must go for overview, a quick overview for the condition of every system and organ, beginning from the head to in the order of cancer pottery, one after another. If there anything left, any guideline, any guides, then patient may tell or not the past history of patient from birth, or at the same time the family history. The patient here family history. Patient family family history, the past history from birth. What, whatever, which one? Not every, not from birth. Whatever it is, what are the things the patient had a travel history, in history, in past history, patient we must inquire about anything, got or required treatment, anything, any trouble, the patient needed treatment. So that those things must be taken cautiously, or must be taken. The family history: father, grandfather, grandfather, parental aunts, uncles, mother, grandparents, maternal aunts and uncles, spouse, siblings, children. What are all the family history that we know? We we know all these points, that the patient must be having any hereditary disease, any genital problems, any genetic problem, any hereditary diseases, hereditary diseases, and any any type of diseases. What in homeopathy we call acute miasms. Any miasmatic guidelines, if there any diseases, any sufferings, anything, any this allopathy treatment, this antibiotic treatment, non-homeopathic treatment that person has taken, or their family, if their family is having the same thing. And once again, that physical examination and laboratory test, all these things, along with all these things, patient, this physician must be, by this time, physician should have a remarkable, accurate picture of the patient in all his phases: subjective, objective, and pathological. And he must be getting a totality. For this totality of symptoms, he can correctly evaluate the symptoms, derive a true image of the patient, and find out a particular remedy. And in this thing, with this thing, I like to end today's session. But before closing these things, closing this today's session, I will tell this: Dr. Hahnemann, our master, guided from the first aphorism. Then don't go for constructing theoretical system, not to attempt to explain phenomena. We need knowledge of disease, knowledge of medicine, knowledge of mentioning causes, and knowledge how to employ this disease knowledge to medicinal knowledge, and how to and these mentioning causes, these, whether it is this cause of the disease, or the mentioning cause occasionally. So totality. So we have all these things are only to find out a particular totality, and to find out a remedy for the patient. And think again in 9, 10, 9, from 9th aphorism to 18th aphorism, Dr. Hahnemann described about the vital force, and how the vital force gets affected, deranged, and how the symptoms comes, and the symptoms. Ultimately, he told us the external manifested symptom. Totality of symptom is a picture of the internally deranged vital force. Then what else we need? So only thing is, we must be very careful to get the totality of symptom, to find out the picture of the patient. That is the only thing. That is the only thing we are hunting for. We must be a physician's or a physician's duty to hunt for the totality of symptom automatically. If the physician gets the totality of there's a good. It is said that a good case taking is a half cure. Half cure. In that sense, a physician must be a hunter for the symptoms to find out the totality of symptom, so to get the remedy. So today's section, in today's section, I will I am I am here. I am just ending today, but in the next two sessions, I will elaborately discuss about the about the examination of mental state, and before that, this thing maybe you can tell, and I must tell it is an introductory session. Thank you, and over to Dr. Devnaran Kalyani.
Thank you, Dr. Mandal. Brilliant presentation. Greatly we have helped, obviously. Moreover, it is on recapitulation of details of the case, taking history to come to the conclusion of the mental status of the patient. We are very sure that until we complete the case history in details, in depth, as it was presented by Dr. Mandal, it will not be possible to go to the mental status at all. Only the purpose to take the mental symptom at last, as he was telling, because by this time patient has become convinced. By this time patient has developed confidence on the physician. By this time, as Dr. Mandal was telling, patient has developed a rapport with the doctor, which is very, very essential. Nicely expressed regarding the status of the mind as per Dr. Freud classification, grossly, ego and superego. Every physician, especially homeopath, must be a person of superego, highly intellectual. We are called to be the class 1 citizen of the country, not a casual thing, because we are the highest intellectual persons of the society. Because of the reason, our intellect is very sharp, very high status. We can mold ourselves according to the situation. We can adjust, we can react fantastically with the patient and with other social affairs. As Handyman has cautioned, as Dr. Mandal expressed, that to take the mental symptom, there is one condition. He alerted us. He warned us that to take a mental symptom, you must be sure that you are mentally sufficiently alert, your mind is quiet, your mind can go to any depth with complete patience without getting tiredness. All the qualities of the mind one homeopathic doctor must have. Otherwise, it is difficult to take the mental symptom of the patient if his own mind is not properly built up. That's why Hahnemann has given us causes. How homeopathic physician's mind will be needs to bring out the mental symptoms. In regarding ego, superego, my conclusion is there are 3 types of living animals in the universe. One is id type, that is, in brief, we can call it as vegetative lives. Those don't have any desires, no very minimum emotions, no intellects, like algae, fungi, bacteria, etc. Plants, they don't have any emotional issues. These type of persons are available in our clinic, that patients are coming simply as vegetative lives, no specific desire, no specific emotion, mentally very poor, very minimum or no intellectual level. Our patient may come also in id type, can come also as ego type. What is ego type? In brief, we can tell this is feelings of selfness, I, my desire, my aversion, my likings, my emotions, my pleasures, my pains, my suffering. These type of persons can be called as biological persons, means like animals, like other insects, beasts. They have hunger, they have sexual cravings, they have some desires, but nothing regarding intellectual affairs. And there are persons too who are intellectually high, a professor, another doctor, an engineer, IS officer. They are highly intellectual. So we are supposed to deal with all these three types of patients. We cannot exclude anyone. How? As Dr. Mandal said, by creating reports. How to create the report? As Dr. Mandal told in very, very details, that go on taking the case in very, very, very details as much as you can. First target is to bring out uncommon peculiar symptoms. Second target is to develop the rapport with the patient by which he will be able to express his mental condition, mental state. Because if we go on taking the cases in very, very details, patient will be astonished. He will be highly confident that none of the physicians before asked so many questions regarding my life, my desires, aversions, etc., my physics, my atmosphere, my family. This doctor is asking so many details just to cure me, having no other conditions. May give some fees, but in hospitals and other places, there is no other condition. Only he is knowing so many details of mine because he wants to cure me. By this only, by detailed case history, 99% report is being produced with the patient. One more thing usually we do, knowing or unknowingly, that by our techniques, by our learning, we change ourselves while we are taking cases. Do we take the case history of a child like as you take the case history of a professor? No, not at all. We are taking a history of a child, we behave like a children, as if he's playmate. We talk like that. When we are talking with the young girls or boys, we change our pattern, our mentality as per his friend, boyfriend or girlfriend, as if of her or his age, friendly relation, friendly talking. The same doctor, when he's talking with the professor, a very old person's old grandmother, we behave ourselves accordingly. Then we behave like his child, his boys, girls, or granddaughter, grandsons. Why? Because we want to develop the rapports, which is very, very important to bring out the mental symptoms, as Dr. Mandal told. So by this creating this automatic change of our mentality, automatic change of our behavior during case taking, we are able to convince the patient. That's why doctors are highly intellectual persons. They can mold themselves according to the situation for the purpose to bring out the uncommon mental symptoms. I will tell you how serious things mental symptoms are. You will see many cases, taking a detailed cases of pages and pages. We have seen in N.I.H. that case history of containing dozens of pages. I don't like to tell the mention of the person who introduced. He was also our teacher, respected teacher. Pages and pages of pages case study. Ultimately, when I left N.I.H. from service, I found casing has down to 2-3 pages. But in my teacher, Dr. Mandal knows very well, P.C. Pal, M.M. Datto, S.K. Dubey, their casting was only few words, not even full sentence. Outdoor card was a slip, means 1/4 of one A4 size page was our outdoor ticket in Calcutta with medical card. That contains whole case history. They will go on asking, and only put the uncommon symptoms by words only, not even by sentence. So casting doesn't mean must be every details. Does not only mean very brief, but it only means that your target is to bring out uncommon symptoms at any cost, either by taking details, whether you put in a short form or long, no matter. But you must be very sure that almost all uncommon symptoms have been collected from the patient. How? Because after the case taking, when you go to the mental symptom, after taking some mental symptom, what usually our teacher is to do, we have learned from them, they will ask direct questions on mental symptom. Do you have this thing? They will say, yes, doctor. What happens by this? Patient will feel that doctor is a magician. How he could know my hidden mental symptom? He's a brilliant doctor because he was able to reveal my suppressed, untold things of his own. But the technique is simple, nothing magic, no magic. He took the case history, whether putting in the note or in his mind, and he concluded that case is like a Buddha. Then ultimately he will ask one question: are you like to take always very tasty foods? Don't like at all to simple foods? Yes, doctor, yes. I cannot take ordinary things. Always I want tasty things. Like a Buddha is confirmed. So this was the tendency of our teachers, which we have seen and experienced in OPD and IPD, that mental symptoms are gems of the cases. If a doctor gets 2-3 mental symptoms uncommon, all other remaining symptoms become null and void. I will give you a few examples. Let me give you example of Dr. Mandal may be knowing. One eye specialist, Dr. S.R. Chatterjee.
Right.
He used to wear coats throughout the year. Even in summer, he will wear white coats. And very smart, very tall, very sharp person, beautiful looking. He was an eye specialist. One day he's seeing cases. One patient was brought by his fellow mates. He has become blind since yesterday. Dr. Chatterjee just saw him and asked the patient, Bosu, 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 Bosu. He sat on the side of a table and Dr. Chatterjee was seeing the cases. We are also observing what he's doing. But we never observed what patient is doing. Now, after a few minutes, about 40-50 minutes, he told, have you observed the patient? We observed, but didn't find anything. Then after clearing other cases, he asked us, you have a drug of reverse in nature. Exactly, reverse will be the behavior, desire, etc. What is the drug? We call ignition. Yes. Give him.
I was there in the same OP.
He was there.
I was there in OP.
And the serious thing was that patient the next week, when Dr. Chatterjee is coming in the hospital, in the gate we ran to him and told, sir, many blind patients has come. So he told us, I have to leave immediately hospital. He heard the facts that that woman started seeing in a very short period. Then he told, I have to leave the hospital immediately. Otherwise, I will be attacked by so many patients, blind patients. All blinds are not of same disease. The fact was that when we asked her why ignition, have you not observed that the patient lady is playing with paper with this blindness, sudden blindness? Can you imagine a patient who has become suddenly blind while he was sweeping corridors? He become blind and he is so pleasant, so quiet that he is playing with paperweight. See the depth of the mental symptom. See observation of allopathic doctors, eye specialists. See what homeopathy is. Ultimately, the patient, at that time, our secretary was Dr. Shiv Shankar Ghosh, our founder secretary of the Alumni. He convinced the patient, see all the blinds are not of same disease. He will see the cases. That patient collected different blind patients from the platform, his village and neighboring. You go to the doctor, within a day, we will be able to see. This is homeopathy. So sometimes one mental symptom becomes gem of the case. Another symptom I like to tell you, probably Dr. Mandal may be remembered, of Dr. M.M. Datta. He used to call us in the afternoon. On a case, every one of us have to take the case history and separately we have to tell the drug. He will ask, what is your drug? Patient will be seated before Dr. Datta. Every one of us with our own case history, we have to tell the drug with justification. These are the symptoms, and this is drug, my drug. And lastly, he will take his drug by which patient is improving. So one day, one teacher, lady teacher, came in OPD. He was fantastically cured in the OPD. Dr. M.M. Datta requested to come to that very special classes, and we took case taking and selected different drugs. Then Dr. M.M. Datta sold the prescription. Patient was high CMS. He left the patient fantastically improved. He asked her, why high CMS? You didn't look, you didn't observe that he's laughing, hard laughing. Being a teacher of that age, about 45 years, He is knitting wool in the outdoor in Homeopathy Medical College before so many doctors and me, and laughing when evil is visible. At that time, Jatra was a very famous program in our locality, as if Jatra artist is laughing. So this laughing is not common for a teacher of that age. And playing knitting wools is not very common. That struck to mind that he is basically AYUSH. So this is mental symptom. One more question I have to cite you. Probably I told you before. A exophthalmic goiter was under me when there was thyroid project in research in N.I.H. I tried for about 2 years, no change. But unfortunately, patient is not leaving me. Every day I'm desiring that patient must go to somewhere else because I can't do anything by trying different drugs. The one day, there was one attendant sister, her name was Lucky. So he was in my clinic, always used to disturb others. Lokiti came and told me, sir, don't see this woman. I told, why? Every day he will come from the gate, from the counter where he made the card, in the dispensary counter. Everywhere he will make quarrels with different persons with different reasons every day. All of us are fed up with this woman. Don't see him. Send her to other allopathic hospitals. See, after 2 years, laches came in my mind that purchasing quarrels, inviting quarrels everywhere, anywhere, whether it improves or not, but his mentality is not being changed. So one attendant is guiding a doctor for the prescription. This is mental symptom. I can give you examples for throughout the night, but such violent symptom mind is so sensitive, so delicate mind is. If once we can concentrate on mental symptom, you will see the gems of homeopathy recovery. There are many examples from you also. So I request all of you, before hunting for the mental symptom, please understand the Hadman's instruction to make our own minds for collecting good mental symptom, how to create reports, how to take the case history, how to convince the patient. Then you will see the brilliant successes. Thank you, Dr. Mandal, for coming and giving your sincere efforts. Thank you to Madam for coming and joining us.
Next 2 sessions, I'll talk about much more about this thing. Just as you were telling about these things, most probably the last class, last 106 CME, you told another one case that is also in this context. That must be once again. It must be said that for a gastric problem, one man used to come in N.I.H. so many times. At last, one day, when I have seen that he is calm and quite having no problem, his case shows no problem. So without any problem, as always happy. It looks like he is so happy. Although he is having so much problem, you have prescribed sulfur. That was a very good. That was a very good case, and that is the same thing as you told. A single mental symptom. The value of a single mental symptom will cover up 100 physical symptoms.
I am telling one example. Yesterday evening, one person aged about 45 years, suffering from rheumatoid arthritis, very high anti-CCP, very high R factor, deformity, tremendous pain. After giving the medicine, giving the prescription, when he was leaving the room, clinic, then he suddenly turned back and told doctor, please try for me. I am suffering so much, you won't be able to understand. Sometimes I feel I should die. Then immediately I snatched his prescription and asked my assistant, change the drug, give him water Medica. And I'm sure that patient is going to improve, 100%. Because of a man of that age, suffering for years together, his desire is to die for the pain. By physical beer, he is maintaining his normal life, he is in the service, government service, but still he is willing to die, suicide. This is fantastic mental symptom. And I'm sure that the case will improve. So anyway, mental symptoms of James or target will be like eagles. What are the mental symptoms? One more thing I want to tell you what I have learned from my teachers, that mental symptoms should be collected beyond your clinic. When patient has comes and waiting, some sounds are coming to your mind. Quarrel, shouting, hasty, or quietness, no disturbance. Then while getting into the chamber, how he is walking, how he is coming, taking the chair and sitting, how he is talking to talk, how his attitude, how his dresses, last slides were fantastic, how he is replying, how he is cooperating, how he is doing while reacting or taking the case, how he is moving his hands and legs. Everything should be observed. And if we develop that sort of vision, many symptoms automatically will come to your mind. As I am giving one example of one of my seniors, that a patient is coming, he has sat in the chair, and when taking the KCC, he is pricking by toes the floor. On the floor, there is one mattress, he is pricking the floor, talking, lady. And doctor observed, stop taking cases, give him Liliantic. So this was the observation. So every point should be observed to bring out mental symptoms, because not only from the animal, we have seen the man is body and mind and spirit, obviously, and usually body is controlled by the mind. First disease come to our mind through miasm, obviously, but first we get mentally sick, then we become physically sick, weak, our immunity falls down in neurohormonal system, engine become irregular, then it suffers. So basic complaint, basic root of the disease is obviously mind. Thank you very much.
Okay, thank you.
Bidyut, please.
Yeah.
You have been muted.
Sorry,
Bidyut.
it was muted.
No,
Thank you, sir. It has been an excellent session, and we are waiting for more 2 episodes to come on 26th of January and 9th of February.
Okay.
So I had been getting personal messages from various doctors. They wanted the PDF or they wanted the details narration. So it's a request to all the doctors who had been watching or sending me the personal message for the write-up. Please go through the session. Wait for the all 3 episodes to go over there to air on till 9th of February, and we'll request our beloved speaker, Dr. Mandal sir, if he can share. He'll be sharing it in the alumni group, and to go ahead with the further deliberation, I had been getting messages from Dr. Utpal Pal's certificate of participation form is not downloading. There has been a technical error, which Dr. Orko Mukherjee had narrated at the beginning. Uh, we had been suffering from certain challenges in the IT part. So this CME session, probably we are unable to uh, give the e-participation certificate. But however, don't get disheartened. From CME number 109 onwards, we'll be having it done as per schedule. And relating the other queries, uh, let us check, sir. There has been no question on this tonight's topic. I'll like Geetha ma'am. Will you want to share something? Dr. Geetha Pillai ma'am? Ma'am, do you want to share something? Uh, I think Madam is
Yes.
unmute, has gone on mute. Yeah.
একটু 10 মিনিট পরে কোনো তারা সেমিনার আছে,
Okay.
একটু আধ ঘন্টা পরে কোনো একটা সেমিনার আছে, একটু আধ ঘন্টা পরে করুন, 10টার পরে করুন।
And just another good news that we will be getting advice from our beloved Dr. Ishwara Das sir relating to the CME upgradation and connectivity with the National Council of Homeopathy for the validation of these e-participation certificates in the coming days. That's
Very good.
a good point to discuss with Eshwarada sir. Dr. Kalyani sir, if you also
Grand,
get time,
grand good name.
get in touch with get in touch with Eshwarada sir so that we can get it connected with the NCH.
Definitely.
And
We can meet in
with
a meeting
this,
too.
and yes, sir.
We can meet in a meeting too with Dr. Ishwar. Comedy
Yeah,
meeting.
we'll be having a the video
Special meeting.
talk, video conferencing talk in
Okay,
a
okay.
with a few core committee executive members in
Okay.
the coming days. And with this, with your permission, though tonight's moderator, Dr. Kalyani sir, he's our president. I'm returning this to our backstage editor, Orko. One more. Okay, Dr. Utpal, thank you for understanding. Nitish Kumar, welcome. Nitish Kumar had given compliments to Dr. Kalyani sir. Thanks everybody for watching this, and we are very proud to announce that till now we are having 120 around live viewers.
Good.
So on a Sunday of the new year, first second week, 120 live viewers is a very big thing. And I hope
Sure.
these 3 episodes will help us to learn a lot of things, a lot of untapped things. We started with the GNM, and after that, on 108, 9th, and 10th, we'll be having the CME session with our beloved Dr. Bankim sir. Uh, with this, I am taking all in the backstage. Thank you, everybody. Please be there for more CME talks.
Thank you. Thank you and good night to all of you. Thank
Good
you.
night, sir. Orko.
Thank you all. Thanks for watching. I hope you have enjoyed today's CME. And if you have enjoyed today's CME, as per Dr. Bidyut Mukherjee has said, I am extremely sorry that we were unable to process this e-participation certificate. But don't worry, we will be processing this e-participation certificate from next CME onwards, and means from 109. So be prepared, and if you have not joined our WhatsApp channel, do make sure to join the WhatsApp channel, because for updates of latest CMEs, the links is in the description box or in the caption box of Facebook or YouTube, from wherever you are watching. So just click on that WhatsApp channel, join there, and just follow the channel as we continuously keep on scheduling, means the give the schedule over there. You can just go and check from there also. And again, one more, we have our Instagram page. Do make sure to follow that. And if you're watching from Facebook, please make sure to subscribe our YouTube channel, and also the YouTube watchers too. It's for you too. Do make sure to subscribe our YouTube channel. Click on the bell icon, red bell icon, means click on the subscribe button, red subscribe button, or white, whatever it's color the showing to your screen. Just click on that and click on the bell icon to get all the notification as soon as we schedule a program. And for the Facebook, please do make sure to give our Facebook page a like and share this video with everyone you know, means your every homeopath you know, and every batchmate, junior, senior, anyone, you can just share with it. And once again, just check out all the links given in the description. And with this is me, Orko Mukherjee, leaving for until then, means until next CME. Good night.